A question we receive very often from patients looking for lip lifts is, what is the difference between a muscle and skin lip lift or a skin-only lip lift? Some people also ask about internal lip lifts. Those aren't very successful, so we won't really talk about those. We'll talk about muscle versus skin. There are different types of skin lip lifts. There is skin excision, and they would just take the lip and bringing it up, and that's called a skin excision or skin-only lip lift. Then there is a modified upper lip lift, which is an evolved form of this where we'd actually release the skin on top of the muscle, release it and roll it over the muscle, maintaining the muscle volume like you would do in an upper blepharoplasty, and then resuspending up to the nasal base. That's a modified upper lip lift. The third type that people would talk about is some form of muscle work. So that means that we release the skin or excise the skin. The muscle is then brought together by doing a plication, an excision, or an imbrication. This means that the muscle from the bottom here is stitched to the muscle in the top. What that effectively does is it pulls up the rest of the lip with it, but it can also inhibit your muscle movement in that area where you did that a little bit. So there's upsides and there's downsides, and it really depends on the surgeon. If you look at the results from muscle or skin lip lifts or skin only or muscle combinations, there is not a big difference. The difference really comes from the surgeon who's doing it. There are surgeons who perform muscle plications with skin excision and they do a beautiful job. There's doctors who perform skin only and do a beautiful job, and there's doctors who perform the modified upper lip lift, which is a subsmass release, again skin only, and they do a beautiful job. So in the end, the answer to that question is, please look at photos. Look at a lot of after photos. Don't look for the technique itself unless you're a doctor trying to learn how to do it. If you're not trying to learn how to do it, what you need to know is the result. Look at the result, look at the doctor's reputation. There are very good doctors out there, but you won't know that unless you see a lot of their results.